student physical therapist Amanda here. So we have Gloria, who's 75 years old with spinal stenosis and muscle spasms. So we're going to do lumbar traction on her today. Some indications of lumbar traction are nerve root impingement, disc herniation, spondylolisthesis, narrowing within the intervertebral foramen, degenerative joint diseases, which she has, subacute pain, joint hypomobility, muscle spasms, the list goes on. Some contraindications that we want to make sure don't affect her are any acute sprains or strains, any fractures, vertebral joint instability, non-mechanical pain, peripheralization of symptoms, osteoporosis, osteopenia, pregnancy, prior surgical stabilization, and the list goes on for that as well. So today we're going to do lumbar traction in supine position with an anterior approach. It's going to be intermittent, and we're going to do about 50% body weight, but to whatever is comfortable for her. And it kind of helps with the symptoms as long as they don't get exacerbated in any way. We're going to do it for about 20 minutes. There's going to be about a 5-second step up, step down. So yeah, let's get started. How are you feeling right now?
Pain.
You're in pain, yeah. So we have that head propped up, so you're a little bit more flexed. But to start, we're just going to get you strapped in here nice and tight. So I want this to be as tight as is comfortable for you because it will be pulling on you. So we don't want your drawers to drop, okay?
Yeah, I don't.
Nobody ever wants that. Okay. So we're getting nice and tight here. Oh, kind of. Does that feel snug?
Yeah, nice and snug.
Okay, perfect.
Big hug.
Okay. So we have this little pump here, and what I'm gonna do is I'm gonna pump it up, and I just want you to let me know when you start to feel it, and then I'm going to keep going up until you feel that it's really stretching, but if at any point it feels worse or anything like that, please let me know, okay?
Okay.
So I'm just going to start pumping it up here. Is there any chance that, I know you're 75 years old, but are you pregnant?
No.
Have you had any spinal fusions?
No.
Do you have any joint instability?
I don't think so.
Okay, I think we're good to use
Okay.
that. Feel anything yet?
Yeah.
Wow, look at it go. Okay, so we're just going to ramp up here, and then we're going to hold it for a little bit, and then we'll go back down. How's that sound?
Sounds good. That's not me.
Okay, then we go
It's a
back
little
down.
squeaky.
Okay, there's our ramp down.
Okay.
Now we're going to ramp back up.
Okay.
How's that feel?
That feels really good.
Okay, now we're going to hold. And ramp back down. We're going to rest for a couple seconds, then we're going to go back up.
Okay.
Hey, how are you? Good.
Now we're going back up.
Alright.
Then we're going to hold. Okay, now that we've done this for 20 minutes, we're going to get you disconnected here, and you're all good to go.
Alright, thank you.
And how are you feeling after that?
That feels a lot better.
Okay, good. Your symptoms didn't get any worse?
No, not worse.
Okay, good.
Thank you. So sweet.